Hi, my name is Dr. Fishman, and I'm a board-certified neurologist and working with TeleSpecialists. I'm going to speak about healing and recovery following a stroke. There's 4 things to really keep in mind and that are very important after somebody has suffered a stroke. The first is that your brain can adapt and heal. The second is you need to stay focused on rehabilitation to regain any lost skills that you might have lost after having your stroke. The third is stroke prevention still matters even though you've suffered a stroke. And lastly, it's important to stay positive and focus on our mental health. One thing to really remember is that even though you've had a stroke, the brain is what we like to say neuroplastic. Practicing any lost skills actually helps your brain to adapt, and it's able to add more connections and try and repair some of the damage that has been done following your stroke. The brain heals by experiences, and as a result, the more focused you are in your rehabilitation, the easier you'll have towards a path of recovery, and this is essential for recovering from your stroke. Remember that stroke prevention is vital. You need to still understand the risk factors that led to your stroke. Be focused and compliant with taking your medications that were prescribed to you by your physician, and it's also important to still stay active after you've completed your rehab. Lastly, as a stroke survivor once said, you need to start thinking about wellness and not the illness itself. Mental health is extremely important. You need to set realistic goals for your recovery, you need to stay motivated, and you need to seek help if you start to feel depressed or anxious.
Hi, my name is Jessica Peterson, and I'm a board-certified psychiatrist working with TeleSpecialists. As Dr. Fishman mentioned, there is quite a bit of overlap in the fields of psychiatry and neurology, especially when it comes to depression after suffering a stroke. Post-stroke depression occurs in about 30% of patients and can have far-reaching effects. It can impact physical recovery and lengthen the amount of time it takes to regain functioning. Studies have shown that post-stroke depression is correlated with poor functional outcomes, and so it's very important to identify and treat this when it does occur. Depression following a stroke presents with symptoms similar to depression in the general population. This can include feeling sad or guilty, having decreased interest or pleasure in activities that you used to enjoy, feeling very tired with poor concentration. There may be changes in sleep and appetite, and sometimes those around you may notice you seem to be moving more slowly than usual. These symptoms can often have a large impact on your quality and enjoyment of life. And when they occur following a stroke, this can delay overall recovery and also contribute to post-stroke fatigue. Fortunately, depression is a condition that is very treatable, and there are many different ways we can do this. One of the most helpful modes of treatment is to utilize antidepressant medications. There are many different medications available that are scientifically proven to be effective and lead to remission of depression. We can also utilize various forms of therapy, including both physical therapy and psychotherapy. This is helpful in addressing overall level of functioning and can also improve resilience. Managing depression can sometimes feel like a very isolating experience, and so involving family members can often be helpful and aid in recovery. Similarly, community involvement in the form of support groups can provide encouragement and help us to not feel so alone, which is very important when it comes to healing. Whichever form of treatment you feel is best for you, it is important to have open communication with your doctors and to actively participate in treatment. The topic of depression can sometimes feel a bit taboo, and one of the biggest barriers to accessing treatment is the negative stigma that we associate with feeling depressed. We often put so much pressure on ourselves to feel better that it's easy to ignore the depression and convince ourselves that we're doing just fine. When we do this, we are the ones who suffer. Depression is much more common in the general population than many realize, and it does contribute to higher rates of disability and mortality. It can affect all areas of functioning and can even present with physical symptoms. Please remember that there is no shame in having depression. This is a very treatable condition, and remission is possible with appropriate diagnosis and management. If you feel you're suffering with any symptoms of depression, don't hesitate to reach out to your doctor or to schedule an appointment with a psychiatrist. If at any time you're having thoughts of suicide, please call 911, present to your nearest emergency department, or call or text the Suicide and Crisis Lifeline at 988. They are staffed 24/7 and can also provide help. Remember, mental health is health. So during Mental Health Awareness Month and all year long, let's continue to normalize this very important topic. It's okay to not be okay, and there are people here who can help.